Today I'm going to walk you through some essential information about Provenge, a treatment for advanced prostate cancer. We'll talk about what to expect throughout the treatment process and how to make sure your procedures run as smoothly as possible. If you have a care partner, this information may be helpful to them as well. Along the way, you'll meet some men who have completed their treatment with Provenge. They'll share their real-life experiences with you. If you have any questions as you watch this video, talk to your doctor or nurses. These people make up your Provenge treatment team. As you may know, Provenge is a first-of-its-kind therapy that uses your immune system to fight prostate cancer. Treatment with Provenge is complete in about a month, and the side effects are generally mild to moderate. Provenge has been proven to extend survival in certain men with advanced prostate cancer. Provenge is made by taking your own immune cells, the type of cells that help protect the body from infection and disease, and combining them with a substance that activates them or turns them on. These activated immune cells are designed to target and fight your prostate cancer. Each of your Provenge doses is made specifically for you.
I first found out about Provenge when I was receiving treatment from my prostate cancer treatment specialist, and she offered that as a possibility for a new kind of a treatment. And so when I heard the word immunotherapy, which is what Provenge is, and using the immune system of your own body, I said, I'm for it, let's go for it.
Let's take a look at what to expect with the Provenge treatment process. First, you'll have a small amount of your immune cells collected with a procedure called leukapheresis. Leukapheresis is also known as cell collection. Your immune cells are then sent to a Provenge manufacturing facility. Here, the immune cells are combined with a substance that activates them or turns them on. These activated immune cells are your personalized dose of Provenge. Your dose of Provenge is then sent to the location where it will be administered to you. At this time, your activated immune cells are put back into your body through a process called infusion. The entire treatment cycle, cell collection, creating your personalized dose of Provenge, and infusion is repeated 2 more times, usually 2 weeks apart. This means treatment is complete in 3 cycles, which typically takes about a month. This includes 3 cell collection appointments and 3 infusion appointments. It's important to keep all of your scheduled appointments and to arrive prepared. Your personalized dose of Provenge, made of your live immune cells, can expire, which means it can't be used if you miss an appointment. Your Provenge treatment team can help you with appointment reminders and schedule updates.
The treatment center that I received my treatment from set out a calendar and told me when I had to be there, what I was going to be doing. It did require me 2 days a week to go up there for both the leukapheresis and then for the infusion afterwards.
The cell collection process, also known as leukapheresis, is the important first step in the Provenge treatment cycle. Before you have your immune cells collected, your Provenge treatment team will check your veins to decide the best way for your treatment to proceed. The common way to have your cells collected is through a vein in each arm. Be sure to bring along a valid government-issued photo ID and plan on having someone to drive you home after your appointment. Also, for your procedure, be sure to wear clothes with sleeves that can be raised above the elbow. During the cell collection procedure, your blood will flow into a machine where it is separated into different parts. A small portion of your immune cells are removed. The rest of your blood is then returned to your body. During your cell collection, you'll sit in a comfortable chair for about 3 to 4 hours. Many patients like to listen to music or watch a movie, so you might want to bring along a portable music or movie player.
They put a film or a video up on a TV, and they said, you watch this, and when you're finished watching it, it will be over with, and it was.
You sit with 3 hours with your both arms out like this. When I finished giving blood the first time, we went out to lunch afterwards, and I felt just fine, ate a nice lunch. When I got it back, we went out and had dinner.
There are a few things you can do before your cell collection procedure to make the process as comfortable as possible for you. Drink plenty of water in the days leading up to the procedure. Avoid drinking caffeinated beverages before your procedure. A calcium-rich meal is also recommended. Unlike surgery, you're encouraged to eat before the leukapheresis procedure. Talk to your Provenge treatment team if you have any questions about this cell collection procedure. About 2 to 3 days after your cell collection, your personalized dose of Provenge will be ready to be infused. Here are a few tips for your infusion appointment. Make sure you wear loose-fitting clothing with sleeves that can be raised above the elbow. Be sure to bring your valid government-issued photo ID with you. And confirm the time you should arrive at the office with your Provenge treatment team. Remember, live cells make up your Provenge dose. Since these live cells can expire, be sure to keep your appointments and arrive on time. 30 minutes before your infusion, you may be given an acetaminophen tablet, such as Tylenol, as well as an antihistamine like Benadryl. These medications can help reduce the chance of side effects related to the infusion. The infusion of Provenge takes about an hour.
They didn't ask anything that was unusual, and my life went on as usual. It went on normally. And so I didn't really think much about my treatment other than the fact just to be there and get it done.
He went to sleep and when they were doing the infusion. And so we sat there, the nurses and I sat there and laughed at him because he was sleeping.
The most common side effects are chills, fatigue, fever, back pain, nausea, joint ache, and headache. In clinical trials, the majority of these side effects were mild or moderate in severity. Provenge can cause serious side effects. In clinical trials, serious side effects reported in patients in the Provenge group included reactions that occurred within 1 day of the infusion, such as breathing problems, chest pains, racing heart or irregular heartbeats, dizziness, nausea, or vomiting. If any of these reactions occur, tell your doctor or nurse right away, as they may be signs of heart or lung problems. Serious side effects reported also included strokes. After your infusion, call your doctor immediately if you get a fever that is 100 degrees or higher. You should also call your doctor immediately if you have redness at the site where the needle was inserted. Either of these may be signs of infection. Talk to your Provenge treatment team if you have any questions about Provenge. The Provenge website can serve as a helpful resource during your treatment. Visit Provenge.com for more information about advanced prostate cancer and how Provenge works. You can also find a list of patient support resources that may be available to you.
By all means, take a serious look at Provenge and what it can do for you. From my experience, it was not difficult at all.
Thank you for taking the time to learn more about Provenge. Remember, the goal of this treatment is to activate your immune system to help fight advanced prostate cancer. The power to fight this disease is already in you. With Provenge, you can help turn it on. Provenge, Sapulus LT, is approved by the FDA as an autologous cellular immunotherapy for the treatment of asymptomatic or minimally symptomatic metastatic castrate-resistant hormone-refractory prostate cancer. Provenge is made from your own immune cells. Your cells will be collected at a cell collection center approximately 3 days before each scheduled infusion of Provenge. There can be risks associated with the cell collection process, which you should discuss with your doctor before deciding to begin treatment with Provenge. Provenge can cause serious reactions. In controlled clinical trials for the treatment of prostate cancer, serious reactions reported in patients in the Provenge group include reactions resulting from the infusion of the drug, which occurred within 1 day of infusion, and strokes. Severe infusion reactions included chills, fever, fatigue, weakness, breathing problems, shortness of breath, decreased oxygen level, and wheezing, dizziness, headache, high blood pressure, muscle ache, nausea, and vomiting. Tell your doctor right away if you have breathing problems, chest pains, racing heart or irregular heartbeats, dizziness, nausea, or vomiting after getting Provenge. because any of these may be signs of heart or lung problems. The most common side effects reported with Provenge are chills, fatigue, fever, back pain, nausea, joint ache, and headache. These are not all the possible side effects of Provenge treatment. For more information, talk with your doctor. Tell your doctor about all your medical problems, including heart problems, lung problems, or a history of stroke. Tell your doctor right away if you get a fever over 100 degrees Fahrenheit or redness at the cell collection or infusion sites, because any of these may be signs of infection. Tell your doctor about all the medicines you take, including prescription and non-prescription drugs, vitamins, and dietary supplements. Tell your doctor about any side effect that concerns you or does not go away. For more information on Provenge, please see the full prescribing information,